Hi everybody and welcome to the prenatal breastfeeding class. My name is Jillian and I'm a lactation consultant here in Miramichi. Today we're going to do a shortened version of the class online for those of you who aren't able to make it to a face-to-face version. At the end we're going to add some additional resources, videos, and contact information for any additional support that you might need. Breastfeeding is something that is very natural, but natural does not always mean that it's easy. As with any new skill, it can take time, practice, and lots of patience. So today we're going to learn together how we can make breastfeeding simpler for you. Nature does things right. The mother's body is designed to produce milk and a baby's body is designed to receive it. Around the 4th month of pregnancy, your body is going to begin to produce colostrum, which is the first milk that the baby needs. At conception, your body begins to lay down mammary tissue, which will help produce the colostrum. You might also notice that around midway through your pregnancy, the areola becomes darker, and that's to help the baby locate the breast after birth. So human milk is something that is really cool, and it is always changing. So it changes to suit the needs of each individual baby. It changes with the baby's gestational age, so if you do have your baby before 37 weeks, your milk will contain more protein to help the baby grow. It changes with the baby's age. So right here we have an example of colostrum, transitional milk, and mature milk. And the colostrum is the initial milk that the baby's going to receive, and it's produced in very small quantities appropriate for the baby's belly size. So this contains tons of antibodies and nutrients to help baby grow and help jumpstart their immune system. This is the transitional milk, which is a combination of colostrum and mature milk, and that's from about day 3 and into about the 3rd week after delivery. And then we have mature milk, and that's for the first year of life, what baby's going to get, what mom will produce. And then after that first year, the milk turns back almost to like a colostrum and contains higher levels of antibodies to help the baby fight off anything that they might be exposed to. It changes also with the time of day. So breast milk in the morning when the mother's breasts are fuller contains more fore milk, and then as the day goes on it contains more hind milk, which is the fattier milk, and the fore milk is the more watery milk that helps quench their thirst. It changes throughout the feeding. So again, when the breasts are fuller, initially when the baby first latches, the milk contains more fore milk, and then as the baby gets closer to finishing and the breasts are emptier, the baby gets more of that fatty hind milk. It changes during the season, so this is one reason why if your baby's exclusively breastfed, you don't have to give any additional water, even if it's hot in the summer, because your milk will adjust accordingly and give them all the water that they need. It changes with the mother's diet, so as the mother eats a variety of foods, the breast milk changes taste, and it helps expose the baby to a variety of different tastes, and hopefully this can help make your baby a less picky eater when it's time to introduce solid foods around 6 months. It changes between breasts, and for that reason is why tandem nursing is possible. The mother's body can produce just what each baby needs, so a younger baby and an older baby. And it changes with the mother's or baby's exposure to infection. So whatever you're exposed to, whatever the baby's exposed to, your body will recognize that and produce the appropriate antibodies to help fight off any infections. Everybody wants to know, how long do we breastfeed for? So the answer from Health Canada is exclusive breastfeeding for 6 months, and that means no other food or liquid. The only additional thing that they need is vitamin D supplement, 400 units a day. Continue breastfeeding for 2 years and well beyond, and the introduction of complementary solid foods around 6 months. There are many practices that support breastfeeding, and offering the breast soon after birth is one of those. So we want to do immediate skin to skin as soon as possible, have that baby close, and try to get them to breastfeed if possible. The babies do slip into a deep sleep around 2 to 3 hours after birth, and they can stay sleepy for the first couple of days. So it's very important to try to get breastfeeding off to a good start right at birth. Skin to skin is another thing that is very important. It's good for so many reasons. It helps the baby adjust to their new environment. It helps regulate their temperature, their blood sugar, their respirations. It helps with bonding, and it reduces postpartum depression, and it helps them also deal with any painful procedures, needles, blood work, anything that needs to be done. It can be done with mom, or it can be done with mom's support person, anybody who's close to the baby. and baby just needs to be in a diaper and in a comfortable position on the chest with the most skin exposed. You can put a light blanket over top, and another thing that it's really beneficial for is mom's milk supply. So cue-based feeding is something that's very important, and that's where we say to watch the baby and not the clock. So we really want to look for early hunger cues, which is baby kind of stirring, opening their mouth, turning their head side to side, and that's the time that you ideally want to offer the breast to the baby, because they're telling you that they're starting to get hungry. So if we don't respond to those early cues, the baby will move into mid-cues, which they're really hungry. So stretching, increased physical movement, putting their hand to their mouth, and if you can get the baby then and have them breastfeed, that's perfect. If we don't catch those cues, baby will move into late cues, and crying is a late cue. So turning red and having agitated body movements. If the baby does get to this point, it's very important to calm them first. They won't breastfeed when they're in a state like that, so talk to them gently, walk around, do some skin to skin, and then offer the breast when they're more calm. Baby's stomach size changes greatly in the first few weeks after delivery. So at 1 to 2 days, you can see the baby's belly is about the size of a cherry. At 3 to 4 days, about the size of a walnut. 5 to 6, it's the size of an apricot. And at 1 to 3 weeks, it's about the size of an egg. So this is one of the main reasons why it's so important to feed the baby frequently. So at least 8 times in 24 hours. And it could be 10, it could be 12. You just need to watch the baby and respond to his or her cues. But because of the small stomach size, it empties quickly, so we need to feed very frequently. This colostrum is the perfect amount for the baby's belly in the first early days, and as the milk changes, that's when the baby's belly will grow. Keeping your baby close to you by 24-hour rooming in at the hospital and then continuing this at home is very important. It's important for bonding, for helping mom learn baby's cues and respond quickly. The babies cry less when they're kept close by with their caregiver. And it also helps baby be exposed to the family's natural bacteria, and instead of being in contact with other healthcare professionals, and just keeping everything kind of in the family. It is really good to do anything that needs to be done with baby in the room, so any vital signs or procedures, they can be all done there, and at home, the baby should be in the room with you as well. There are practices that can hinder breastfeeding as well. So artificial nipples, we try ideally not to give any for the first 4 to 6 weeks after birth, and this is to not confuse the baby and get them accustomed to sucking on an artificial nipple. So you can see the mechanisms of suck are very different. They use different muscles. The baby's mouth with the bottle doesn't have to be open as wide as with breastfeeding. The nipple of the bottle, see here, doesn't go as far back in the mouth, whereas the nipple when the baby's breastfeeding goes right to the soft palate. The throat is nice and open for the milk to go down, and with the bottle feeding, the position of the baby's throat can be kind of closed, and baby doesn't have as much control over the flow and how much they take, so it's very easy to overfeed, whereas with breastfeeding, they have complete control over how much they take. So supplements for non-medical reasons. Ideally, we try not to supplement baby, but if we do have to use something other than mother's breast milk, we would try to do it with either a cup or a spoon, and that's to not introduce the artificial nipples. So interventions during labor and delivery are sometimes necessary, and just to make note that a baby that does receive, if the mother receives medication during labor and delivery, that baby can come out and be sleepy and have a difficult time breastfeeding. So it's very important to do skin to skin either way, and manually express breast milk to give to the baby either with a cup or a spoon, and continue to stimulate the breast even while baby is sleeping. So there are many different positions with breastfeeding, and the same principles do apply for all of them, but there's hundreds, and you can decide what works best for you and your baby. One thing to remember is baby always needs to be well supported. The ear, shoulder, and hip should be in a nice straight line. Baby should be turned in right belly to belly no matter what position you're using. And baby should have a nice space for his or her nose so that they can breathe easily. Their chin should touch the breast first, and their throat should be nice and open so that they can swallow just like if we were having a drink of water. So the first there is the cradle position, and that's just kind of how a mother would naturally hold a baby. So you still want to make sure baby's in that nice straight line and they feel supported, but it's just cradling the baby at the breast. Cross cradle position is great early on because you have nice control over the baby, and it's good when mom and baby are both learning to breastfeed. So what you would want is to support baby's back with your forearm and hold the baby's neck at the base. And that's because if we hold up on the head, the baby's reflex naturally is to pull back. So we want to hold nice and low here and support the neck so baby has control to pull off or turn if they need to, and we don't stimulate that reflex to pull the head back. Baby's still in a nice straight line and turn belly to belly. So the football position is great for mothers with larger breasts or with a C-section, and it can be used for anybody. It's just to support the baby still down here at the base of the neck and support with your forearm and bring the baby up just like you were holding on to a football. And the sideline position is really great too. A lot of mothers really enjoy this, and it can be very relaxing. And you can see here the baby's still in a nice straight line and turned right into mom. The baby-led position, or the semi-reclined, allows baby to kind of latch independently, and mothers really enjoy this after delivery. It kind of lets baby just get how they want to be comfortable, and moms can be really comfortable too. And the saddle position is great for a mother who might have a more forceful letdown. It allows baby to cope with a copious amount of milk, and babies can latch really well in that position too. So this picture here shows a mother nursing twins, and that is just to demonstrate that our bodies can produce milk enough for 2 babies. And just with the stimulation and feeding, if it's removed, it will be produced, and you will have enough to feed twins if you want to. And tandem nursing shows a new baby and an older baby both breastfeeding, and the mother's body is able to produce exactly what both of those babies need. So the latch is one of the most important things with breastfeeding. In order to get a nice wide latch and have a baby breastfeed well, you want to try to run the nipple along the upper lip to stimulate the baby to open wide like a yawn. Wait until the baby opens before you bring the baby into the breast, and really it should be the chin that touches first. And what we want, sorry about that, is to cover the bottom, more of the bottom of the areola in the baby's mouth, because it's their bottom jaw and tongue that does the work. So the milk ducts are all along the outside of the areola, which is why it's so important that baby's mouth is open really wide. We don't want baby to latch just on the nipple because they won't get enough milk, and mom will definitely have pain. So here we have an example of a good latch, and you can see there baby's lips are turned outwards, baby's mouth is covering a good part of the areola, there's a nice space for baby's nose, and the throat is nice and open. And here's an example of a baby that's just on the nipple, which would be comparable to us drinking through a bitten straw where you can't get a whole lot out of it. So baby's just got the nipple in his mouth, the chin's far away from the chest, baby's not well latched, and the mother would definitely have nipple trauma and pain, and baby's not going to get enough milk. So signs of successful breastfeeding. How do we know baby is getting enough to eat? So from 6 days onward, the baby should have at least 6 heavy wet diapers, and it should be clear urine, and that's in a 24-hour period. 3 or more yellow seedy stools and in a 24-hour period, and 3 could be 5, 6, 7, just it might be every time baby eats, or it might be a couple times with each feeding. Baby should have adequate weight gain, so it is normal that babies can lose a bit of weight after delivery. But they should be back up to their birth weight by 10 to 14 days. Baby should be active and alert. You should be able to hear swallowing when baby's feeding, and baby should seem content when they come off the breast. And one thing to mention is it's important to offer both breasts at a feeding. So if baby comes off one side and seems content, you want to offer the next side just to let them decide if they want a little bit more or not. And sometimes they may take both breasts, and sometimes they might not. And it's the same as us, where we might have a big meal one time and then just a snack the next. It's totally normal. And the breast should also seem softer after the feeding. So here's some examples of baby's poop. So right here we have a picture of meconium, and that's what you're going to see in the first couple of days after delivery. And here is an example of transitional stool, and that is just after the meconium passes. And then we move on to the yellow seedy stool, and we can definitely see lots of explosions. So the second night with a breastfed baby, or second night with any baby, can be very difficult. The babies kind of wake up and they're just getting used to their new environment. They may look to breastfeed constantly, and that is to stimulate your milk production, and it's also to comfort them and help them adapt. So it's very, very normal, and it's very important that we just comfort them and offer the breast as often as they want it. They may also kind of mimic that behavior when they're going through growth spurts. So around 10 days, 3 weeks, 6 weeks, 3 months, and 6 months, babies do go through growth spurts, and that's their way of telling your body to produce more milk because they know that they're going to grow. So they might look to feed constantly for a couple of days, and that's totally normal. Feeding and breastfeeding is a way of comforting the baby, so it's important to observe their cues and feed them whenever they want to be fed. So here's the end of the presentation. Thank you everybody for listening. Don't forget to check out the additional links and contact information.